I'm Haley Calvert. Is circumcision the right choice? Yes, I'm talking about penises. Let's all get our giggles out of the way now, shall we? So you want to cut off my what? Doctors recommend circumcision for most newborn boys. Too many parents blindly agree without fully understanding what they're agreeing to. If it's not broken, don't fix it. There's usually no medical reason requiring circumcision. Most men will say being circumcised is cleaner. This is not necessarily true. Most men think women prefer a circumcised penis. Also not necessarily true. There are lasting traumatic psychological effects resulting from circumcision. How would you feel? When my son was born, I took him in for a checkup, and we heard a horrific scream coming from the next room. When the doctor came in, I asked him about it. He said it was a little boy being circumcised. I decided that day no one was going to touch my son. Many people have difficulty reading about circumcision or watching a video. If observation bothers adults, imagine how the act itself affects little children. If you can't handle watching it, don't do it. In the U.S., circumcision is considered completely normal. It's a little strange that the most important advocates of routine male circumcision are experts in women's health who know little and could care less about the male anatomy. Recommending routine circumcision as a prophylactic measure is scientifically unfounded. When circumcision is performed, it does not typically treat any disease, injury, or other health problems. Most physicians have real trouble justifying unnecessary surgery. Charles West, quoted in History of Circumcision, which you will find in your handout, said the only indication for removal is furnished by the disease of the organ itself. Circumcision may increase the risk of developing gonorrhea and chlamydia. More hygienic? Not really. Most men think women prefer a circumcised penis. However, in a recent study, women preferred anatomically complete men overwhelmingly to circumcised men. Without the foreskin to provide a movable sleeve of skin, intercourse resulted in the need for lube and discomfort and less chance of having an orgasm. Circumcision is traumatic. The consequences resemble post-traumatic stress disorder. Adult symptoms associated with circumcision include shyness, anger, fear, powerlessness, distrust, low self-esteem, relationship difficulties, and sexual shame. Did you know the foreskin on the average adult male is about 12 square inches of highly erogenous tissue? Cutting off the foreskin removes many fine touch receptors and results in thickening and desensitization. Male satisfaction with circumcision depended on knowledge about circumcision. The more they knew, the less satisfied they were. They wish they had the choice. Fortunately, men can restore their foreskin. It won't be the same as it would have been before, but there's a link on there that can show you how to do that. Did you know female mutilation, cutting, circumcision was legal until the 70s? Circumcision violates a major principle of medical practice: do no harm. It also violates all 7 principles of medical ethics. While a PhD is valuable, it doesn't mean doctors know everything. I don't expect you to take my word for it. All I ask is that you do your own research and make your own informed decisions. Thank you.